Hi everyone, my name is Ron Enders and I'm the Preparedness Coordinator for the Lawrence County Health Department. And I'd like to thank you all for taking a few minutes out this day to review this short presentation. We are going to be holding on May 20th, that's a Wednesday, from 11 to 3 p.m. a drive-through clinic at the Lawrence County Community Center in Bulldog Lane. That's the building that's opposite from the high school here in town. This is going to be a simulation of a strategic national stockpile event. Now, what does that mean? Well, basically, the government has set aside large quantities of biological and chemical antidotes, medicines, and vaccines to take care of the American public in the event that there should be a mass release of biological or chemical agents into our environment that would be extremely harmful or deadly to the population. These are kept at secure locations throughout the country and released upon an emergency event. Years ago, the public health departments were charged with preparing plans and methods to dispense these medicines to the entire county population within a 72-hour period. We've been working to perfect this for a very long time. Because of the large number of people that would be expected to receive medicines, holding such an event at a local public health department would be impractical due to the size and location of the facilities. We have been looking for other areas, other places to dispense these medicines, and one of the most popular venues for medical dispensation of late has been the drive-through clinic. What we want to simulate on Wednesday is a mass release of anthrax into our community. Anthrax is a non-contagious but very deadly antigen that would absolutely destroy most of the people in the town. We want to let you have a chance to participate in the drive-through so that you would become familiar with exactly the venue of receiving these medicines should there be a catastrophe of this nature. It also gives us a chance in a real-time event to review our plans, to see what works and what doesn't work. Only by perfecting, our plans through exercising can we best protect you folks. So we're going to run one of these. We'll be just handing out candy. There's no real medicines. This is not an actual event, but it's a simulated event to allow all of us to participate together as a community. For the first 100 people, the first 100 drivers, I should say, that come through, we will be giving out a $10 gas card as an incentive. Now, you have to be a Lawrence County resident to receive the gas card, because if this were a real event, each county is given a certain number of doses that would be given out to its own population. People would be expected to go to their own counties to receive medications. So sticking as true to format as possible. Again, only Lawrence County residents can receive the gas cards for the event. And there can only be one gas card given out per vehicle. Now, this doesn't mean that other people can't come and participate in the event even after the gas cards are given out. Any number of people who come, the more people who come, the better we can actually determine how successful this event could be. Now, as part of this presentation, I'm adding a segment which myself and our environmentalist Tanya Horn put together to show exactly the route, where the building will be, and what will be expected at each stop along the way through the dispensation clinic. So I hope you stay tuned after I get through here and watch that little segment. And again, if you have any questions at all about the event, the time, or any aspect at all, please give me a call here at the health department. I can be reached at 606 638-4389. Now, if you're the type of person who doesn't like to talk on the phone, you can always send me an email at ronald.enders, that's ENDERS, at ky.gov. Hi everybody, I'm Ron Enders. I'm the preparedness coordinator for the Lawrence County Health Department, and we'll be holding a drive-through simulated mass dispensation clinic on May 20th from 10 to 2 right here at the Lawrence County Community Center. What I wanted to do for you folks today was just to do the route so that you will have no real questions or problems the day of the event. We're going down the road. This is Bulldog Lane. We have the middle school on the left, and we're heading up to the high school that's straight in front of us. On the morning of the S&S drive-through clinic, as we come to this part of the road here, there'll be someone down here right off to the right here with a sign pointing the direction that they'd like you to follow. We're going to be taking a right here, and straight in front of us is the Lawrence County Community Center. As we get a little further along, you'll be stopped by someone right here. There'll be an individual right here who's going to ask to see whether or not you have your proper credentials. The event is for Lawrence County residents only, so you need to present a valid driver's license. Now, as a head of a household, you can pick up the little candies that we'll be using to simulate an anthrax medicine. You can pick them up for the household. The big thing to remember is that for the first 100 cars that come through on that morning, you'll receive a $10 gas card from the Lawrence County Health Department. So be prompt. Another thing that they'll be doing right here is directing you into which lane of traffic that you're going to want to go into. If you're an oversized vehicle and cannot fit under any of the tents that we're going to have this day, you're going to go to the immediate right here, and there'll be a tent with a clerk who will ask you to wait until a nurse can be brought over to you. We're not anticipating a lot of numbers of oversized vehicles, but it's something that we're taking precautions for. For the rest of you folks, you'll see a series of 3 tents. They'll be set up right in the middle. None of these cars will be here that day. The first one is going to be a registration tent. Let me just assume it's this car for a moment. And they're going to get an idea of how many people you need and some other information. And once they have that in the records, you'll be sent along to a large 20-foot tent in which nurses will be handing out little candy bags that simulate the type of medicines that you get if this were a real anthrax event. Should not take long at all. These will be pretty well pre-packaged for the families. We know exactly what doses and what type of medicines are needed for adults and children. Okay, when we're done with that, we'll continue along to a third little tent, and there'll be a checkout nurse here who will make sure that you are, in the case of a real event, would make sure that you didn't have any contraindications to medicines that you took coming through from the nurse's station, and to give you your gas card if you're one of the first 100 through, and some other information. Once you're done with that, you'll be requested to go down through the back of the building. Again, these cars will not be here. These are employees, the social services. They'll be asked to move for that morning, so we don't have any potential fender benders. And we will go with traffic flow. There should be someone standing right where that dumpster is, pointing you in the proper direction, which is going to be to your left. Now we get through the left and right up in front will be another person who will help direct traffic so that you can exit from the area safely without having any incident with other cars in the lot. And you will be directed, first of all, not to accidentally hit pedestrians. Straight down this road here and out of the parking lot. There'll be traffic cones. There will be members of the Lawrence County ROTC, student volunteers, who will be helping with any questions that you have and helping direct traffic. Hopefully the entire event will take, a relatively short amount of time for you. And again, this is something that we will set up in case we ever do have the need for a mass vaccination clinic, in which we will need to vaccinate large numbers of our population in a very quick and timely fashion. Again, once we're done, we exit the grounds back to the road, and you're on your way. And for all those who are going to be participating, I'd just like to say straight up, thank you so much. This is testing a critical resource for our community, and your cooperation is greatly appreciated. Thank you.